In this video, we're going to be discussing hip impingement, what it is, why it's happening, and if you're watching this video, why it's probably on your right hip. And even if it's not on your right hip, why you still want to watch this video. What's up guys, Dr. Joe here from Identity Physical Therapy, and today, like I said, we're going to be talking about hip impingement, so I want to get right into it. What is hip impingement? So hip impingement is when the head of the hip, so the ball of the hip, gets pinched in the socket and it keeps banging into the socket wall, and you feel that pain typically right in the front of your hip. The other problem that it usually causes is some type of hip labrum tear or fraying or something along those lines, because the hip labrum is a thin film that goes over the head of the hip and it gives the hip stability. So it holds the hip in the socket. And so if I keep fraying that and banging into the socket over and over, we can get a hip labrum tear as well. Now, the reason I said in the beginning why it's probably on your right side is because human beings are right side dominant, right? We've talked about this in previous episodes, but human beings are right motor dominant. The biggest reason why is because we have heavier organs on our right side and gravity is coming down, so it pulls us to the right side. So with that being true, oftentimes what you'll see is humans will put a bit more weight on their right side, and when that happens, it can actually drive the hip up into the socket more. Right, so to show you this, imagine both feet are on the ground and then gravity is coming down and pulling us down on the right. That's going to ride that hip up into the socket more, which is going to give us more predisposition to get hip impingement on the right. Now, the reason I said if it's on your left hip, you still want to watch this too, is oftentimes people still get it on their left, but it's a secondary compensation, meaning that they've had issues on their right side. They thought that that kind of went away on its own, and then all of a sudden, or a few months or a few years down the line, now they feel it on their left hip. The reason that that often happens is because the body is an amazing compensator. So if you were pulled down on the right, your body says, I can't live like this my whole life, and so it does actually the opposite. Now squeezes you further down on the left, and it'll pinch up the left. So now that we know the origin of hip impingement and we know what it is, then what we can conclude is that this is not something that you can stretch yourself out of or just foam roll and loosen up your hips and think that it's going to go away. Those things are going to bring blood flow back to the area, which might feel good and help temporarily, but ultimately we know hip impingement is truly a socket and a bone disruption. And so to actually undo this and to actually change the root cause, what we need to do is decompress the hip that is being impinged, and we ultimately need to change the position and the orientation of the pelvis. So how do we do this here at IDPT? So if we know that, let's say the right hip is being covered up like this by the socket, then what we do in the beginning is first use exercises and strategies to get the pelvis to rotate backwards a little bit, and that will give us some space in the front of the hip. And most of the time, you'll actually start feeling mobility and relief right away just doing something like that. After that, the side that we have the hip impingement on, that's the side that we need to actually be able to push out. So when I say that, so let's take that first step where we get that pelvis to rotate backwards. Then from there, what we want to do is effectively create some more space in that hip. And the way that we do it is by pushing out of it. So I'll show you examples of an exercise or two where we do that. And then from there, if we had a turn of the pelvis in one direction, well, now we need to start to get it to turn the other way. So we brought it backwards, we pushed out of that side to give us even more space. And then finally, we want to use maybe muscles on the other side to pull this pelvis back to be more centered and more even again. So what I want to do is take you through an example progression that we'll use here at IDPT. And for about 80% of you watching here today, if you do this for about 2 weeks, you're going to feel a major difference. Now, for others, they just want or need more, or maybe they're just not getting the full relief that they want, or they just want to be able to get back into the gym and lifting and doing all the things that they used to do without pain and without making the issue worse again. So if that's you, then you can click the link in our bio or go to our Instagram page or our website and fill out a form to see if you're a good fit for what we do and if you're a good fit for a free consultation. But like I said, about 80% of you are going to take this information today, and it's going to make such a major impact that you won't even need that. All right, so we mentioned that the first thing is that hip that's being covered on the front side. We need to bring the pelvis backward because that's going to create space in the front of the socket. So I'm going to give you an example exercise of how we can get that pelvis to rotate back. So you're gonna lie on your back and you're gonna have your knees and hips bent to about 90 degrees. From there, I want you to slide your feet up the wall just a little bit higher, but don't go so high that the inside of your foot here turns out. I don't want the foot to lift up like that. So make sure you can keep your whole foot flat on the wall. From there, if you look at my pelvis, I'm gonna roll my hips underneath me without squeezing my glutes or without squeezing my abs. For some, that's gonna feel really weird to be able to do that without squeezing, but think of it as less motion and really passive. From there, we're gonna reach our hands straight up to the ceiling, and we're gonna push our chest away from our hands. We're kind of pushing everything slightly into the ground. From here, we're gonna push through our heels. We're gonna breathe in through our nose and take a long, soft breath out through our mouth. We're gonna do this about 3 times for 10 breaths. You shouldn't feel any tension or pinch or any symptoms in your hip. If you do, bring your feet up a little bit higher or get a little bit further away from the wall. All right, so now that we got the pelvis tipped back a bit, I mentioned that we want to be able to push out of that right side. So what that means is literally how it sounds. We're gonna use our leg and try to push through that leg. So in this example, we're gonna do the right hip. So you're gonna lay on your back with your knees bent and your feet flat on the ground. From here, you're gonna bring the non-affected hip toward your chest, okay? The foot that's on the ground, we're gonna push through the inside of the foot. So the inside ball of the foot and the inside heel. We are not gonna lift our hips up off the ground, but we're still gonna push our heel down into the ground as hard as we can. We're gonna hold that push the whole time. We're gonna reach this elbow towards this knee, and then we're gonna hold for about 6 breaths. We're also gonna do that 3 to 4 times. You should feel the inside of the hamstring working the whole time that you're pushing down into the ground. Breathe in through your nose and out through your mouth. So we're gonna continue to push out of that side. So we're gonna use a weighted step-up variation here. So I have a weight in both hands. So again, the right hip is gonna be our example here. So what you're gonna do, you're gonna step up with that leg and you're gonna drive the other knee toward your chest. This whole time, just like the last exercise, I'm really focusing on being tall and trying to drive through the inside of my heel and the inside of my forefoot. From here, I'm gonna step back, but I'm not gonna shift my weight off of my front leg. I'm gonna stay heavy on my front foot and then step back up again. And then step down and get right back up. Don't stay at the bottom. As soon as you hit the ground, come right back up. I wanna see you try to get about 15 reps of this 2 to 3 times. Again, there should be no pain. All right, so we've tipped the pelvis back to create space in the front, and then we've pushed out of that hip. So last, what I want to finish with is an exercise that's going to pull the other side of the pelvis and turn that pelvis away from the affected hip. All right, so you're going to lie on your back in that original position that we started with, but then you're going to take the affected hip and you're going to put it up to the ceiling. From here, you're going to get a little tuck. You're going to be heavy on this front heel, and you're gonna lift up off the ground so that the top of your hamstring turns on. From here, we're gonna hold this right here for 6 breaths. Do this 2 times. All right, guys, so to reiterate, hip impingement or even a hip labrum tear is not something that you can stretch your way out of because it's a hip that can't move around in the socket effectively. What we need to do is bring that socket backwards, bring your whole pelvis backwards to create space, and then we need to further push out of that hip to create even more space, and then use muscles on the opposite side of the pelvis to turn the socket away from the hip and ultimately recenter your body. Like I said in the beginning, guys, for about 80% of you, this is gonna be a really amazing starting point. You're gonna feel that you're gonna be able to get back into the gym and start doing the things that you love pain-free. Having said that, a lot of times this issue is caused by the way that you're training or the way that you're moving as a whole. And so you may really benefit from a movement evaluation or a few treatment sessions so that we can really guide you in the right direction. So if that is you, again, click the link in the bio or head over to our Instagram or our website at identitypt.com. As always, guys, please like, share, subscribe. Comment if you have any more video ideas, any questions. And I look forward to seeing you guys in the next episode.